Hello everyone, we are from SGDP3. In this occasion, we would like to present our student project entitled Zinc Supplementation for the treatment of acute respiratory tract infection in children. Here are our team members.
Thank you for the opportunity. My name is Putu Anindya Pradevi, with last three digit of the number is 159. Allow me to explain about the introduction. Zinc is a key trace element that supports multiple immune functions, including epithelial barrier integrity, immune cell signaling, and regulation of inflammatory cytokines. Deficiency leads to impaired immunity and higher susceptibility to infection, which support the biological rationale for studying zinc in acute respiratory infections. Cruel clinical evidence showed mixed finding. Some systematic review indicate that zinc may shorten or lessen the severity of viral upper respiratory infections, but broad recommendation cannot be made due to major heterogeneity in doses, formulation, timing, and study populations. Overall, the observed benefits are modest and context-dependent. Emerging research suggests that zinc may also function as an adjunct to antibiotic in severe pneumonia or lower respiratory tract infections. Therefore, high-quality standardized RCTs remain needed, particularly in zinc deficiency group. The reviewed article entitled Role of Zinc Supplementation in the Improvement of Acute Respiratory Infections Among Children in Iranian offers valuable population-specific data, and our appraisal evaluates the strength of its evidence and its relevance for zinc as a therapeutic or adjunct options in RE. The problem formulation, writing purpose, and benefit are stated in this slide.
My name is Patricia Clarence Simpson with last three digit number 125, and I'm going to explain about the question formulation that is used in this systematic review. So we are using PICO. For the population is children under about 6 years old, mainly preschool kids or infants in Iran, hospitalized with acute respiratory infections, including pneumonia or bronchiolitis. For the intervention is oral zinc supplementation, like zinc sulfate syrup or drops, given in addition to standard therapy, which is, for example, antibiotics. The comparison is standard therapy alone without zinc supplementation or placebo plus standard therapy. The outcomes include clinical improvement of respiratory infection, including resolution of signs or symptoms such as fever, respiratory distress, cough, tachypnea, and others, and earlier hospital discharge or reduced length of stay. Thank you.
Good afternoon, my name is Silver Pro, and the last three digits of my name is 148. In this student project, we search using PubMed's advanced search, and the keywords used are zinc supplementation or zinc therapy, and acute respiratory tract infection or acute respiratory infection or ARIs or respiratory tract infection or RTI, and children or pediatric, and treatment or recovery or clinical outcome. To get the best evidence, the search was limited to meta-analysis, network meta-analysis, or systematic review published in the past 6 years, and 17 articles were found about the study of zinc treatment for ARIs in children. As for our critical appraisal, we chose the systematic review titled Role of Zinc Supplementation in the Improvement of Acute Respiratory Infection Among Iranian Children. This was published in 2020, and this review included 5 RCTs involving 522 children under 6 years old. They were hospitalized with respiratory infections such as pneumonia and bronchiolitis. That's all from me, thank you.
Thank you for the opportunity. My name is Niputu Ulan Prasanti and my last three-digit NIM number is 138. In this occasion, I would like to present the journal search. Across the included studies, zinc supplementation, mostly given as syrup, was compared to standard care or placebo. Almost all studies reported that zinc improved respiratory symptoms and shortened hospital stay, although one study showed no significant benefit. The authors emphasized that factors like age, gender, birth weight, and type of infection may influence treatment response. They concluded that zinc is promising, but more well-controlled studies are needed, especially those measuring baseline zinc levels to determine the optimal therapeutic dose for children.
Hello, my name is Ananto Ismail, last digit number 198, and I'm going to explain about is PICO answered clearly. In the journal itself, the PICO elements are presented clearly and systematically. The population is explicitly defined as Iranian children under 6 years old who are hospitalized with acute respiratory infection, such as pneumonia or bronchitis. The intervention is also stated with zinc supplementation with the detailed description of dosage and treatment duration provided across the included randomized controlled trials. The comparison groups are also well identified as placebo or standardized therapy without zinc, ensuring a valid assessment of zinc therapeutic effects. And then the last one is the outcome are also clearly stated, focusing on improvement in clinical signs and symptoms such as reduction in respiratory distress and fever, such well as shortened hospitalized time, all of which are summarized in the study tables. Maybe that's all for me. Thank you.
My name is Putu Anglita Wirasayani and my study digit of ID number is 185 and I'll be presenting about the importance and relevance. So first, in terms of the magnitude and precision of the association, the 4 clinical trials showed majority showed significant improvement with zinc. The Falafi et al. Study showed improved RSS and reduced length of stay, and for the Habibian et al. Study, it showed reduced fever episodes, cough, and hospitalization duration. And the Hyderian et al. Study showed no significant difference, and overall, consistent clinical improvement in zinc groups across studies. The study showed statistically stable results with small p-values. The study population in this research consisted of children under 6 years of age who experienced acute respiratory tract infections, including pneumonia, bronchiolitis, and the common cold, and who were hospitalized in healthcare facilities and Iran. The characteristics of the participants range from 2 to 60 months of age with a balanced distribution of sex, and the diagnostic variations remained within the same category, namely respiratory infections. So the findings might be relevant to patients with the same cases.
Hello, my name is Nyaman Gede Wiragunadri Paramarta, and my last study number is 180, and I'm going to explain are the article inclusion criteria appropriate. The inclusion criteria used in the systematic review were highly appropriate. The authors limited their evidence to randomized controlled trials, ensuring the highest level of validity for assessing therapeutic effects. They further narrowed the population to Iranian children under 6 years old, which certain the clinical relevance and applicability of the findings. Additionally, the criteria focused specifically on zinc supplementation as the intervention and its impact on acute respiratory infection. Together, these strength and well-defined parameters allowed the reviews to draw from the most relevant, consistent, and high-quality evidence available to evaluate the zinc's effectiveness in this target population. So that's all for me. Thank you.
Hello everyone, my name is Patricia Alinjatan and the last digit of my student number is 171, and I'm going to explain about are the included studies valid. The studies included in the systematic review are generally valid because most were randomized controlled trials which provide strong evidence for evaluating an intervention. Several trials reported adequate randomization and used placebo controls, improving internal validity. However, not all studies clearly describe allocation concealment or blinding procedures, creating some uncertainty regarding selection and performance bias. Baseline characteristics between groups were mostly comparable, and outcomes such as symptoms improvement and duration of illness were clinically relevant and measured consistently. A limitation is that many studies did not assess baseline zinc status, which may influence treatment effect. Despite these methodological gaps, the overall evidence suggests that the included studies were reasonably well designed and provide moderately reliable conclusion. That's all for me. Thank you.
Hello, my name is Putu Asrini Prorasini Astawa and my last 3-digit number is 161. Research findings on zinc supplementation in children with ARI are not fully consistent, showing clear heterogeneity. Some studies, such as Falavi et al. 2011 and Brooks et al. 2004 reported faster symptom improvement and shorter hospital stays, while others like Haidarian and Amini 2011 found no significant effect. These mixed outcomes indicate that results are not uniform across studies. This heterogeneity is likely due to difference in patient population, diagnosis studies, dosing regimens, and varying study quality. Some trials use fixed dose
others use weight-based dosing, and many didn't assess baseline zinc levels, which may influence response. Therefore, although several studies suggest potential benefits, the overall evidence remains inconsistent and must be interpreted cautiously. Thank you.
My name is Putu Adrian Mahadiwibawa with three-digit number 134. Allow me to explain the implementation of evidence and value-based medicine. So application of zinc as a treatment for acute upper respiratory tract infection in children within an evidence-based medicine framework must be integrated within the principles of value-based medicine. This aims to maximize economic efficiency and facilitate policy making regarding effective resource allocation.
Thank you for the opportunity. First of all, my name is Putri Balkis with the last three digit student numbers 136. Right now, I'm going to explain about applying the evidence based on the meta-analysis study that we chose. Applying the evidence-based medicine on zinc supplementation for treating acute respiratory tract infection in children requires careful evaluations of available research and its relevance to clinical practice. Several randomized trials indicate that zinc affects the short duration of illness, reduces symptom severity, and decreases hospitalizations time in pediatric patients. However, systematic reviews also showed inconsistent findings. Some studies reported no significant therapeutic effect. As a decision maker, clinicians must also incorporate patients and family values, as parents might have different considerations about their acceptance of supplements, expectations for faster recovery, and preferences for natural or low risk treatment. Zinc supplementation might provide greater benefits in regions where zinc deficiency is prevalent, whereas well nourished children may show insignificant improvement. Interpreting the evidence also requires a critical analysis on methodological gaps among multiple studies. None of the RCTs included in this meta-analysis measured serum zinc levels before or after supplementations, despite the known influence of birth weight, geography, air pollution, and population density on zinc status. This inconsistency led to other important questions about whether response to zinc differs between children with true zinc deficiency and those with normal baseline levels. These limitations explain that clinicians must apply this evidence cautiously and underscore the need for future studies that stratify outcomes by zinc level, age, nutritional status, infection type, and dosing measurements. Maybe that's all from me. Thank you.
Ms. Putwa Adrian Mahadiwibawa with three-digit number 134. Allow me to explain once again about the value-based medicine in this paper. So the cost-effectiveness analysis showed that the zinc supplementation has a positive effect by reducing cost in the treatment of acute respiratory infections in children. So all of the articles reviewed by Mostak and Amiri, except one, the one study that I'm talking about is the Hadrian et al., is different from the others. Meanwhile, all the other studies showed the effectiveness of zinc supplementation in improving respiratory infections in children and reducing the length of stay. So the study by Hadrian et al. Was found to be inconsistent with other studies because the initial nutritional status is normal, so there are no zinc deficiencies found. So giving zinc supplementation is not really going to give any effect. And the severity of the disease with the sample characteristic is really different compared to the other studies. And there were differences in daily zinc doses and shorter duration of zinc supplementation by the study of Hadrian et al. That explains why there's some inconsistencies in the findings between the articles mentioned or reviewed by Mostak and Amiri. So as for the cost utility analysis, Mostak and Amiri did not provide specific quantitative figures on the cost saved, such as hospitalizations and other costs that could be shaved, but the clinical results implicitly indicate the potential for significant cost reductions. So it would be better for them to do some specific analysis there because the potential is there, but it's still not really, you cannot really conclude much from the paper.
Okay, my name is Asikirana with real life student number 087, and now I would like to explain the conclusion of this student project. Zinc supplementation has a well-established biological role in supporting immune function and demonstrates potential clinical benefits in children with acute respiratory infections. The critical appraisal of the selected systematic review indicates that most randomized controlled trials report improvements in clinical symptoms and reductions in length of hospital stay when zinc was used as an adjunct to standard therapy, although the results were not entirely consistent across studies. The use of the PICO framework and a structured literature search strategy facilitate the identification of relevant high-quality evidence. However, methodological limitations are identified, including heterogeneity in study population, dosing regimens, and diagnostic categories, as well as the absence of baseline serum zinc measurements and limited reporting of adverse events and effect size metrics. From an evidence-based medicine perspective, the application of zinc supplementation should be individualized by integrating search evidence, clinical expertise, and patient or parental values, as zinc should be regarded as an adjunct rather than a replacement for standard therapy. In terms of value-based medicine, zinc supplementation shows potential economic value by reducing hospitalization duration and associated healthcare costs, although detailed cost effectiveness and utility analysis were not consistently reported. Overall, zinc supplementation may be beneficial as an adjunctive therapy for acute respiratory infection in children, but current evidence remains limited by methodological heterogeneity and insufficient economic and safety data, highlighting the need for further well-designed studies to support routine clinical use. That's all from our student project. Thank you.